One of our delegates placed his first pterygoid, and it was like he won the lottery. And he was literally going around celebrating, and even in the evening, placed my first pterygoid.
It's a small group, it's 8 people, it's interactive. They get the full experience of what it's like to place zygomatic implant.
Well, you can see from day one how nervous the delegates are. The second day, you can see it definitely changes. They're more prepared, and by the third day, quicker, confident, and more positive with everything they're doing.
What is the difference between this live patient zygomatic implant training and other courses that are maybe on cadavers?
The big difference on training on live patients is that you're dealing with a real patient, and the real patient means that you will see the anatomical variations, you'll see the complexity, the complications that can arise, and by having the live patients there to treat, you will see these patients and follow them up. Also orientations and the bleeding, raising the flaps that go around live surgery. A cadaver, it's easy to actually place the implants under supervision or to not see the complications or problems with patients that are moving. Any sort of surgery that you do when it's live patients changes your whole outlook of how you're training.
After doing live patient training with yourselves, are you confident that your students can return home and execute live patient surgery on their own patients safely? So Rudi, Riz, what made this course special for you guys personally as opposed to any kind of regular course that you've been on before, or lectured before, or taught at before?
I've been part of a few live patient training courses out here in Dubai, as well as in other places. And what I found about this one, obviously being biased because this course has been a piece of work that Riz and I have been working on for some time. It's just nice seeing people telling us at the beginning what skills they want to leave with, and then at the end hearing them say that they can now go back and do this kind of treatment on their patients.
I think that's very rewarding, seeing how they develop within 3 days. Obviously everyone's apprehensive and they're very keen to do the surgery, and after 3 days you see how much they upskill. I think that's been really important. We've done a lot of lecturing, run a lot of courses around the world, and what you find with this course is that you find that at the end of it they get a lot more out of it. And I think live patients is very, very important because you can drill on models and you can have all the lectures, but until you're there physically doing the work, that upskill becomes a very quick way to do it.
And was there a standout moment in the live surgery aspect of it this week that really stuck with you guys?
Yeah, I think one particular delegate, Eddie's transnasal, was great because that was not expected. It wasn't part of the original treatment plan. All of our delegates were given a kind of an Easter egg hunt over the 3 days, try and tick certain boxes for different procedures and tips of things to try out, and that was a good moment because he was so proud of himself. And no, there's been a few others, but it's been a really good course.
Yeah, and I think the standout moment has been one of our delegates, Shari, placed his first pterygoid, and it was like he's won the lottery. And he was literally going around celebrating, and all I heard, even in the evening, I placed my first pterygoid. So it's nice just to see that kind of the look on their face. And I think there's many standout moments if you think of it as a whole with different delegates, and collectively I think it's been just a fantastic course.
Would you say the delegates had a positive experience overall?
We have to ask them. Yes, I would say definitely. Certainly the feedback that we've been given, so far, and that's actually the beauty of doing the course during the day and then socializing with them in the evening and having sort of more informal feedback about how the day has gone, and being able to then come in the next day and actually tailor the course to what they want and choose specific patients to fulfill what they need, and seeing that sort of actually come through. So yeah, I think they've had a very positive experience.
What progress did you notice from day 1 to day 3 as they were completing their final surgeries? What was the big improvement with the delegates?
Well, you can see from day 1 how nervous the delegates are. Obviously their level of confidence, that I think over the second day you can see definitely changes. They feel like they're more prepared for the second day of surgery, and by the third day there's a big change in their confidence where they're really getting it stuck in quicker, more confident, and more positive with everything they're doing. So within 3 days it's incredible how much surgery they cover, but also when they go back and reflect, which I think is important, as Rudi said, in the evenings we talk about it, and the next day they feel like they've learned more, and by day 3 you can see the big change in their level of surgery and skills.
Are the delegates free to contact you after their time here to get support and guidance on surgeries?
Well, this is one thing me and Rudi have discussed extensively when we were putting this together, is that we want to make sure that once they've done the surgery and they've gone back, that they're not left to their own devices and they have nowhere to turn. After every course that we run, we create a group that people can get onto. They can discuss their cases with all the group collectively, because what we found when we lectured in South Africa quite a bit is the treatment planning sessions have been probably the most kind of best thing that they could do at the end of it. So we were running courses, but that bit, they really took their time and enjoyed it to a point where we wanted to, it was getting late in the evening, they wanted to carry on. So by having that and a group discussion, especially like afterwards, then they can all put case up and everybody can look at collectively how to treatment plan a patient and how they've progressed. So yeah, there's always going to be support after the course.
If delegates want to return to do more surgery or get more experience under your tutelage, is that possible?
Yeah, absolutely. So we run the different courses at different levels deliberately to sort of almost make a modular educational experience for people, so that they can start off with, you know, relatively straightforward full arch, and then move to more complex full arch. So we have a Zygomatic Pterygoid course as well, which is aimed at more experienced practitioners, as well as sinus grafting and various other procedures. And we find that many people come back multiple times. They just love the experience so much.
How long have you guys been doing Zygos? How did you get into it, and why did you get into it?
Well, it's quite fun. We had this chat earlier. I've been doing full arches for over 20 years, which I know I don't look old enough, but I've been doing it for a long time. And Zygos I've been doing for probably over 12, 13 years, maybe slightly longer. And we were discussing that I used to see a lot of cases doing zygomatics, and one of my main jobs in the UK is going around doing zygomatic implants. And I got into it simply because I was doing so many full arches, and I got to a point where I thought I'm not doing the patient justice because I'm trying to get everything squeezed in to the anterior part of the maxilla and cantilevering and trying to find other solutions that were not maybe predictable. And so a natural progression, I think, is when you do enough arches, you realize you have to upskill. So I wasn't doing pterygoids, and I started doing more and more zygos, and I got more and more into it, traveling around the world, learning my skill through mentorship and then doing my own. And I think there's a whole learning experience of doing your own cases, and you see normally problems and complications 5 years later, 6 years later, when you've been in the game long enough. And then you realize that actually these small changes make a big difference, to a point now where we're confident and doing this enough that we can teach others how to do it safely. I think that's important.
Riz and I used to lecture together. We've been lecturing together for maybe 6 or 7 or 8 years. You know, I was there to lecture about pterygoids and Riz was there to lecture about zygos. We'd often sit there talking and looking at cases, and I'd be like, well, did you consider a pterygoid here? And he'd look at my case and say, you know, for me this would be a zygo case. And this sort of natural progression of moving toward one another's mentalities started just from understanding the long-term outcomes. And my journey in zygomatics was, you know, with some of the top zygomatic surgeons out there. Very fortunate to spend time with some of the greats. And Riz as well. We managed to do a few cases together.
Yeah.
I think we operate quite well together. So we've done a few live surgery cases.
It's very natural to work together, and I think that I feel really blessed to have Rudi as somebody who I'm running the course with, because we've almost kind of combined our skill sets to meet where we think we operate, and we look at cases very in a similar way. And I've picked up a lot of tips from Rudi in terms of the pterygoid side of it, which means that we can offer from both perspectives, I think, an overall good way of delivering a course.
And what's the structure of the Zygomatic live patient course? Are there some lectures and then live patient surgery and case reviews, or is it straight into surgery, or what have you found is the optimal way to teach?
We'd expect delegates to have some level of full arch experience if they're coming to learn about zygomatics. What we don't want to do is have them in a lecture theatre for hours and hours learning about things that they probably already aware of, but we did feel that at least one full day of theoretical training is necessary.
And will you be providing that one full day of lecturing here in Dubai?
Yes, there will be a full day of theory, but not in a big lecture theatre. It's a small group, it's 8 people, it's interactive, so that people are able to get their head around everything before they operate on patients from the following day.
It's important to have that one day where you bring everybody's knowledge up to a kind of certain standard and certain level that everybody's now singing from the same hymn sheet when we go into surgery the next day.
Will I get an opportunity to place zygomatic implants on live patients?
Absolutely. So we grant temporary Dubai licenses so that our delegates actually operate on patients under supervision, so that they get the full experience of what it's like to place zygomatic implants, with all of the associated nuances that differentiate that from operating on a cadaver or on a model, i.e. a real life breathing, bleeding patient, and how to manage those tricky situations that can come up. When everything looks nice and easy on a scan, as we all know, those of us that are clinicians will know that, in real life things are different. So to be able to do that in a safe and controlled environment gives people a huge amount of confidence going back to their clinics.
Is the hotel, evening dinners and lunch included? And are there any additional costs to what I will have to pay?
The course fee includes the hotel stay in a 5-star hotel, the Sofitel Obelisk, just down the road from here. So the 3-night hotel accommodation is included, as well as all of the social events that are put on by the facility, and lunches are provided.
If my patient needs pterygoid implants or any additional implants, will I be charged extra for placing those implants?
When we're talking about doing zygomatic implants, if there are additional implants and additional procedures that need to be done for that patient, there's no extra charge. A lot of the zygomatics will probably end up having pterygoids as well, and that's all included.
Will you guys teach me the digital workflow? Will my patient get teeth the same day?
Yeah, we think it's essential for delegates, even delegates who might only be involved in surgery in their sort of day-to-day life. We think it's essential for them to have at least an appreciation of that sort of day of surgery workflow to give patients teeth. That's why patients are having the zygomatic implants in the first place. But it also makes us better surgeons to understand how the prosthodontic workflow operates.
I'm worried about the complexity of the cases. Can I view the CBCT in advance of coming to Dubai? And can I have a printed model to practice on before doing the surgery?
Absolutely. We believe that these are essential tools to get a well-rounded education, especially when you're carrying out a procedure that you may never have carried out. To be able to look at the scan, study the scan, ask us questions about it, as well as having a physical model to be able to visualize your anatomical landmarks, I think is a great thing to be able to have before even coming for the course.
Yeah, this is complex surgery, and we take that training very seriously. We've seen many courses where delegates are trained on doing zygomatics, but the complexity and the small nuances and the changes in anatomical variations are not considered, and therefore the models and the CT scans are very important to look at and go through before they operate on live patients.
Is the surgery done under local anesthesia or IV sedation or general anesthesia?
The operations we carried on under local anesthetic. Sedation is available as well for patients that require it. But we do not offer general anesthetic in a practice setting.
What is the difference between this live patient zygomatic implant training and other courses available out there that are maybe on cadavers or otherwise?
The big difference on training on live patients is that you're dealing with a real patient, and the real patient means that you will see the anatomical variations, you'll see the complexity, also the complications that can arise. And by having the live patients there to treat, you will see these patients and follow them up. And I think that's really important. And also orientations and the bleeding and everything that goes, raising the flaps that go around live surgery. That's essential as part of the whole training. A cadaver, it's easy to actually place the implants under supervision, or to not see the complications or problems with patients that are moving, with everything else that's going around. And I think any sort of surgery that you do when it's live patients changes your whole outlook of how you're training.
None of the things that are challenging about zygomatic implants can be simulated on a model or in a cadaver. The only thing you can simulate is the direction of the implant itself, which delegates will find fairly soon is actually the easiest part of the process. It's far more complicated to navigate yourself around the patient and their anatomy, and whether you've numbed them properly. A cadaver's not going to be able to tell you that you haven't numbed them properly.
And there's usually no bleeding with a cadaver as well.
They usually don't bleed, yeah. So it is absolutely essential to learn this type of thing in a controlled environment.
Will I get CE certification for CPD hours after doing your training?
The course is eligible for 32 hours of verifiable CPD.
What's the typical structure of live patient zygoma Dubai?
So the first day is a crash course in all of the theoretical concepts, the anatomy and the basic surgical principles that underpin zygomatic and pterygoid implant surgery.
The next day we do live surgery in the morning and the afternoon, so there's cases in the morning. There's 4 rooms running, so each room will have a case, and in the afternoon as well, and that goes on for 3 days. So lots of surgery over 3 days. The delegates will be doing live surgery in the morning and the afternoon. So, make no mistakes at this when they come here. it's surgery. Okay, people think they might be relaxing in Dubai. That's maybe in the evening at some point. But if they're here to learn, then 3 days of surgery, operating morning and afternoon.
Do you guys believe that the world needs more implant surgeons? What do you think implant dentistry will look like in the next 5, 10 or 20 years?
I mean, I think there is a mission to bring the kind of treatment that has always been seen as a sort of a luxury item for the wealthy to those people that really need it. And it's not just a problem in a handful of countries, it's a problem all over the world. So if you're going to, service that level of need, you're going to need to build an army of clinicians capable of providing this kind of treatment, safely and cost effectively for people all over the world.
I think safely is the key word there. And I think there will be a need for more. There are people out there, we've only just scratched the surface, here and globally, where people are needing this treatment. But I think if the clinicians are trained properly, we can effectively offer this treatment.
After doing live patient training with yourselves, are you confident that your students can return home and execute live patient surgery on their own patients safely?
I think these delegates will go back and feel more confident to perform this surgery, because the nice thing about doing live patients is that, especially with all the different types of mentors they have, supervisors, everybody has their own technique, and we all learn from each other, and they learn from that collectively, and they will go back and pick up these tips and tricks, and I think they'll be very confident. And also we're still available afterwards to mentor them and talk them through the cases. So I think that transition is a very nice way of getting into doing more confident full arches.
Well, one of the key differentiators of live patient Dubai training is the fact that there's a very highly experienced, competent practitioner supervising each room, who rotate across the 3 days. So all of the delegates get to sort of experience being mentored by somebody different but equally capable, and that gives them a really well-rounded learning experience, which is not easy to find. And we also find that as a location, Dubai is very easy to get to. With sort of overnight flights. We know that a lot of people don't like taking time off work, so to be able to work a full day, get on a plane and be learning the following morning in a sunny country is actually really convenient compared to flying out to other parts of the world where you really have to take a full week off work to be able to get maybe 2 or 3 days worth of training in. And that's made this a very, very popular thing.
And if delegates or viewers want to learn more about your courses, can they contact you on your website or on your socials? Where would they go?
Go to www.theglobalimplantInstitute.com. There we have upcoming courses. They can register in the courses, they can register their interest, they can follow us on social media, which is the Global Implant Institute on Instagram. So either way they can contact from there, and we will get back to them with the courses.
And do you guys have your personal Instagrams that they can also follow and track your cases, where you share surgical tips and pearls?
My one is Dr. Riz Syed, and you can follow me where I'm lecturing, wherever it is around the world. My cases, I'm quite open with sharing the photos and the scans, or Facebook as well, and also the Global Institute Facebook as well.
Mine can be found here. Can't remember what it is.
Even I can tell you, Dr. Rudi Implantology.
Dr. Rudi Implantology.
Even I know that.
Who should we thank for making this course possible?
So I'd like to thank our sponsors, Southern Implants, for supplying the implants, which have been fantastic. The delegates have got to place the SP1, which is a very good implant, and the feedback has been incredible. I'd like to thank the staff here at the clinic, who have been fantastic. Without their support, it's not possible. The nurses, the support staff, and also the faculty. The faculty here in Dubai have been phenomenal, and also the visiting faculty that have come in, Jess and Simran, to help us with the course.
Also a shout to Raman, who was here with us from iMetric 4D or ICAM, giving us technical support, as well as showing our delegates how to use photogrammetry to get the best possible results. So the entire sort of digital workflow, which is really a massive value add for this course, not just being able to carry out surgery, but to learn how to provide a full end-to-end day of surgery solution for patients. So we also have Sprint Ray to thank for our printing solutions in resin, for delegates being able to fit their own prosthetics on the same day. The socials as well, so expertly managed and arranged by our Dubai team, Texas to Brazil, Top Golf, and various other places that our delegates have enjoyed.
I'd like to thank the delegates themselves who've made the effort and put their trust in us to, educate them as much as, we can, and for flying out here and making this actually an experience for us as well, a very positive experience.